Troy Family Dental, and we're going to talk about toothbrushing today. This is a typodont, so it's a model of some teeth, and we're just going to go over the proper way to brush. First, it's always with a soft bristle toothbrush, and you want to replace them every 3 to 4 months. And you want to just take it at an angle to the gum line, 45-degree angle, not 90 like this, not straight down, but a 45-degree angle, and just a real gentle scrubbing motion. Gentle is the key. We see a lot of really rough brushers and it damages the teeth a lot. So just a real gentle scrub. You want to do 1 to 2 teeth at a time. You want to take at least 2 minutes to brush, so 1 minute around the whole bottom, 1 minute around the whole top. And you want to get along the gum line. The most important part to get, that's where most people miss, is the gum line. So right along here, making sure to reach along the insides, also behind the front teeth as well, and right along the insides here as well. Again, you don't want to do big sweeping motions. You want to keep it pretty small. There's obviously different size heads for different size mouths, so this would be an adult size brush. There's smaller ones. 2 times a day, 2 minutes each time. You want to make sure that it's every morning and every night, whether tired, weekend, anything. It's 2 times every day is the most important thing, and always using a fluoride toothpaste. They have ones that have tartar control and ones that have sensitivity, which works really well if you do have sensitive toothpaste, but the most important thing is making sure that there's fluoride in the toothpaste. We'll talk also about flossing, which is very important to do at least once a day. I know a lot of people don't do it once a day, so if we can aim for 3 times a week, that's still better than never. You have 2 different kinds. There's your regular floss, which you want to take about an 18-inch piece, and then there's little flossers, you want to call them. And they're used really in the same way. When you have the regular floss, you want to just wrap it around your fingers, probably your 2 middle fingers, and have just a little piece to work with like this. And then, I guess there's no way to show that. You just want to really curve it around the sides of the teeth, not just slam it up and down in between teeth. Just really gently wiggling it down and curving it around, and then kind of rotating the floss so that it's always a clean piece. Same thing if you're using these, you need to clean it off and make sure that in between each tooth, wipe it down or rinse it under the sink or something so that it is not just transferring bacteria and plaque, because the whole point is to remove plaque and bacteria, which come from all of your food sources, especially sodas, Gatorades. Those kinds of things can really cause a lot of damage to your teeth, and that's the whole point of brushing and flossing, is to remove all of the sugar and all of the bacteria and all of the plaque off of your teeth at least every 12 hours. So morning and night. You can always add in a 3rd one. Okay, we generally start seeing kids for checkups at age 3. The American Academy of Pediatric Dentists does recommend earlier than that, as soon as their first tooth pops through, to go see a pediatric dentist. That's usually just kind of a look and see kind of visit, but they're usually cooperative enough for dental care at age 3. And we just want to make sure that they're all happy visits and good fun visits, and then every 6 months for cleanings and checkups, so that we can make sure that you're doing a good job with your brushing at home, and also make sure that there's no problems with the teeth. Everything's looking good and healthy. I like to say don't wait until it hurts, so we hope that nobody ever gets a toothache. But definitely if you're feeling overall cold sensitivity, usually using a sensitive toothpaste will help with that enough to get you by. I should say, some people have to use that as their everyday regular toothpaste, but coming in every 6 months is the best way to determine if there is any problems. But definitely if there's ever a toothache that doesn't go away, or even if it does go away with like ibuprofen or Tylenol, still just come have a checkup and we'll take an x-ray and make sure everything is looking good and see what's going on. Another really important thing to talk about is fluoride. I know a lot of people don't get enough fluoride. Fluoride is a mineral that is in the water supply. It's naturally occurring in the water supply, but they do add some, in most municipalities, they add some fluoride to the water. A lot of people don't drink tap water anymore. It's almost all bottled water and filtered water. So a lot of people don't get enough fluoride in their daily diet. So making sure your toothpaste has fluoride in it. Also, using a fluoride mouth rinse is almost never a bad idea. Just the regular cavity protection, either the Act brand or Crest, Colgate, any toothpaste that says it has fluoride, mouthwash that says it has fluoride is the key to help rebuilding enamel and keeping your teeth good and strong. For children, they can use the training toothpaste while they're learning, which is fluoride free. As soon as they're proficient at spitting, they can use a small smear of fluoride toothpaste on the toothbrush. Usually around 4 is probably when they're good at regularly spitting it out. And then again, same thing with children, making sure that they're either drinking a lot of water that has fluoride in it, or even they have fluoride mouth rinses as well for children specifically when they're old enough proficient at spitting, which is the important thing, making sure that it doesn't get swallowed. The reason soda is really not good for your overall health especially, but for the mouth, is it's got 2 evil components to it, I should say. The sugar that's in most sodas, and even with diet sodas, it's the acid that's in the carbonated drink. So it's like giving your teeth a sugary acid bath every time you take a sip. It's okay to have them sometimes, but it definitely needs to not be your all-day, everyday drink, especially for children. The teeth break down so easily when they're exposed to Gatorade and Powerade and Mountain Dew and Pepsi and all of the drinks that kids want. Even Kool-Aid, juice still has a lot of sugar in it, so it's fine to have, but it needs to be a once in a while drink or with meals only, not sipping on it all evening long. So making sure we're brushing twice a day, everybody, twice a day, 2 minutes, even as soon as you see that first tooth on a baby. Flossing every single day and seeing your dentist every 6 months for checkups, cleanings, and making sure that your overall health is the key. So the oral cavity is the pathway to the body. So keeping that healthy is very important for your overall health.